Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
For centuries, ancient cultures knew the secrets to longevity, vitality, and healing. Now, modern science is catching up. Ageless Blueprint is a podcast that will reveal the modern secrets of better health and a better life. Join Dr. Eldred Taylor here today and every Wednesday at 9 a.m. Eastern Time on W4HC Radio at W4HC.com. As together we discover the secrets to better health through science and spirituality. A Better Life with Ageless Blueprint starts now. Here's your host, Dr. Eldred Taylor.
Hello and good morning. I am Dr. Taylor. I'm the hormone doctor and the spiritual MD. And this may be one of the most important podcasts that I will do because this is patient education. And the reason why I think this is so important is almost every day I see a patient that comes in and this is what really sparked me. I told you, usually Monday or Tuesday, I get an inspiration of what I should talk about on Wednesday. And so I had a patient on Monday who I had seen 2 or 3 years ago, and I had her hormones all corrected and she was fine. And this is like 2 years later, and she came back to me and said, "Doctor, I need you again." And she said, I was on progesterone, I was doing fine. And then I started talking to my friends and my doctors, and they kept telling me, "Oh, you shouldn't be on that because it can cause cancer." And she got confused and she stopped. And now she's miserable, and I had to re-educate her. So one of the reasons why I started this podcast and I'm on all the social media is because I need patients to understand their bodies and not be influenced by anybody, not a doctor, not a friend, not a relative. No one, that you are the expert on your body. And I can teach you. I used to do a lecture, and I'm going to start it again, that I can teach you to be an honorary gynecologist in about 5 minutes and 4 slides. Now I'm going to take a little bit longer, but I'm going to really educate you on how the female body works. And the reason why I'm focusing on females is because they have the most issues. They go through more changes. They go through puberty, and it's a little different than men. They have their reproductive cycle that's very delicate, has to be just right in order for that to work correctly. And then they have menopause. Now, I know men may have andropause, but it's not as significant. And another reason why is that there was a study that came out that said only 9% of doctors felt like that they could manage menopause. Now, 100% of women who live past 45 are going to go through menopause. So how could 91% of doctors not know how to handle it? And when I talk to doctors, and I just talked to a doctor yesterday who wants to work with me, I can see she doesn't understand menopause. And that's what I have to teach her. And I want to teach other doctors. And so if I can't teach the doctors, and I'll tell you this, it's unlearning is twice as hard as learning. And so whatever the doctors have learned, it's going to take them some time to unlearn it. It took time for me to unlearn what I did in my residency program. So patients haven't learned some of this stuff. So I think it's easier to teach you, and you can go in armed with information that you are 100% certain about, so that you can discern what is true and what is false. And you can do it. Don't think that because I have a white coat on, or that somebody else who you think is smarter than you tells you something that is true. It doesn't have to be. You need to know enough that you can make decisions about your health regardless of whatever is out there on the media, on TikTok, on Instagram. And I've seen some of the stuff, and it angers me. And I told Rebel before, I started this. I'm going to try and get through this without becoming angry, because it angers me that so many people are out there just talking nonsense. So they're trying to promote something that they're trying to sell. So whatever I tell you today is going to come straight out of the OBGYN textbook, the textbook that was supposed to teach me physiology, but it really taught me more pharmacology. So I'm going to just talk about physiology today. All right. So I have a lot of information to get through. I'm actually going to make sure that this is on YouTube so you can go back and reference it. It'll be on the AgelessBlueprintPodcast.com. I'm going to make clips of it and reels of it, because I really want patients to be able to fill in the gap that these doctors don't know. Only 9% of doctors feel like they know how to handle menopause. And I'll question if even those 9% understand it. So anyway, let's get started with the slides. I don't want to go too much. All right. That's a little bit off because the G is down there. But anyway, learning is remembering. So there's a quote that says, if you want new ideas, read old books. And so that's why I started the Ageless Blueprint, because if you really want to know good new information, you need to go back and look at old information. Okay? Because I'm going to tell you, as time goes on, things get distorted. So the closer you can get to the original truth, the better off you're going to be. So I don't concern myself with new studies, because anytime man is making a study, they can manipulate it to make it say whatever they want it to say. So I want to look at the basic, old, foundational information, and that is what you can rely on. And that's what I learned by going to ancient Egypt. And I look at all this stuff, is you want to go back to remember what has already been discovered and not always looking for the new thing. All right. So learning is remembering. Now, here's another big problem, is that popular thinking. I'm going to show you what the popular thinking is on menopause now. But there is a problem with popular thinking, because the problem with popular thinking is that it does not require you to think at all, because it's easier to do what other people do and hope that they thought it out. And that's the problem. We look at the news, we look at these expert panels, we look at doctors, and we like, oh, I know they thought it out. Or you look at your friends and family, oh, they've been through menopause and they did this, so they know more than I do. But that's not the case. You need to think for yourself. Don't assume that somebody else has thought it out for you. You need to be the master of your self, of your body. You need to know your body. You do know your body better than anybody else. And when somebody tells you it's just normal or it's just aging, you need to fight against that and say, no, I know my body. I don't care what you're telling me, something is wrong, because the doctor is usually telling you that you are not sick, but you know that you are not well. And that is the key. You want to be well, you want to be whole. And I will tell you, in medical training, that is not taught. We are taught, I'll just give you an example. When you are in medical school, you're primarily in the hospital. So in the hospital, you're taking care of sick people. You're taking care of people who need a hysterectomy. You're taking care of people who need their baby delivered. You're taking care of people who have abnormal pap smears. You have all of this. But in the real world, when you're in the office, patients aren't hospital sick. Okay? They have functional problems. They have things that aren't functioning correctly, but they're not at the stage of disease. So the popular thinking is to treat people like they are sick. Okay, so that's why you get all these drugs, and they suggest surgery and all of this, because we are primarily trained in the hospital. We don't do a lot of office work. So when I got into the office and I saw all of these problems, I really didn't know what to do. Okay, I'll just be honest with you. And so we just throw drugs at you because that's what we did for sick people. All right. So when they say that you're normal, they're just saying you're not sick. But again, you know you're not well. So let's go to the next slide. So here's popular thinking. I don't know why this got off like this, where my letters are off, but never mind. This is the information that's important. So here's popular thinking. You measure hormones in the blood. Wrong. Give estrogen and testosterone in pellets. I can't tell you how many times I've heard people talk about, I got pellets for estrogen and testosterone. And pellets are not magic. Pellets are just this new thing that people are promoting. Doctors can get paid for it. There's a company out that is really promoting this, but there's nothing magic about pellets. What is magic is balance. And we want to always balance hormones. And the only way you can balance hormones, only way you can balance anything, you have to measure it appropriately. Okay? You can't balance something if you can't measure it. So they give progesterone orally, which is fine, but here's what doesn't make any sense. You give pellets because you only have to do that every 3-4 months. Okay, you come in, you get the pellets put in, you don't have to worry about anything for 3 or 4 months. So that increases compliance. But the problem is most people don't have progesterone pellets. I can offer those, but they don't have progesterone pellets, so you have to take the progesterone orally. So I still have to rely on you to do something every day. And I'll just tell you, the more a doctor has to rely on a patient to do something, the less likely it's going to get done. So a lot of times these patients, they have the pellets, but they don't do the progesterone orally just because gets busy and they don't do it. And now you're dealing with unopposed estrogen, which is always not a good thing. And you'll see why. And then I keep seeing that testosterone is important for energy. And I will tell you that that is not the case. And I'm going to try to get to that point too, is that testosterone is not important in women for energy. The problem is cortisol, but most people don't test for cortisol appropriately, so they don't see that that is the real problem. And I can do a whole podcast just to show you the importance of cortisol and energy and how you correct it. But giving testosterone for energy is not supported by the literature. I'm just telling you it's not. All right. So let's start with the first popular thinking, that you can measure hormones in the blood. And this is from Spirov, the textbook on GYN endocrinology and infertility. And this is an old book. It was in 1994. But let me tell you, blood and serum has not changed since 1994. Okay? So just because this is 30 years old doesn't mean it's outdated. It's always been like this. Okay? So it's unable to easily distinguish between bound and free estrogen and testosterone. It has a large normal range, and this is the key, provides limited clinically useful information. Okay? So if someone is drawing blood on you, they're not getting any significant clinical information. They're just not. And that's why in the GYN residency that I did at Emory University, right down the street from where I am now, we never were taught to draw blood levels. Never. Okay? Because it didn't tell you anything. And I can go into the reasons why. It's fat soluble against water soluble. Hormones are fat soluble. And I'm going to show you this and why I do saliva testing. It's based on physiology. But if you are having your hormones tested by blood, I'm just going to tell you the doctor is guessing. You're being treated by trial and error. And they say I go by symptoms. So if I give you a dose of something, I have to wait and see what kind of symptoms you have before I change it. And then I have to change it again, see what kind of symptoms you have. Do you know how much time can pass when you're doing trial and error? And I hear patients all the time, oh, my doctor keeps adjusting my dose. If you had good testing, you wouldn't have to keep adjusting the dose. I hardly ever have to adjust the dose because I can test it and see where the imbalance is. And most of the time I can get it right the first time. So that's the difference. All right. So this is what I want to teach you is what is the menstrual cycle? The only reason why women have menstrual cycles is to get pregnant. Okay. That is for reproduction. And this is how it works. And I'm going to show you a diagram, but I want you to take a note of this, is that estrogen is dominant the first 2 weeks of your menstrual cycle. The reason why is that last month you didn't get pregnant. So all of that tissue that was there preparing for a fertilized egg to nourish that fertilized egg, it gets washed away because it says you didn't get pregnant. So estrogen comes around to stimulate the regrowth of that tissue. All right. So estrogen stimulates growth. Now, what I want you to understand is that estrogen stimulates growth of any estrogen sensitive tissue. So what's estrogen sensitive tissue? The breast, the uterus, your fat tissue. All right. So if you have more estrogen around, you're going to overstimulate your breast so you can get fibrocystic breast, you can get breast cancer. You also can have fibroids because it's stimulating the abnormal growth of that muscle tissue in your uterus. So estrogen creates growth. Now, progesterone should be dominant the second 2 weeks, and progesterone stimulates development and slows growth. So progesterone slows down the growth, and it wants to develop that tissue to get prepared for pregnancy. So if in any system you have growth without development, you have an abnormal system. And the definition of cancer is undeveloped, undifferentiated growth. So if you have estrogen around without progesterone, you can have overgrowth of tissue that's not developed normally. Okay, so that's why you get fibroids. That's why you get fat around your hips. That's why you can get breast cancer. That's why you can get abnormal moods, because you have this imbalance of growth and development and differentiation. All right. So just think, whenever you hear estrogen, you think growth. Whenever you think progesterone, you think slowing down growth and stimulating normal development. All right. So let me tell you how this system gets screwed up. Okay. I know this looks complicated, but I'm going to go through it one by one. All right. Now, this is the lining in your uterus that grows and goes away based on whether or not you're pregnant. This is your ovary making a cyst, and this is an egg that comes out. All right. This is estrogen the first 2 weeks, and the blue line is progesterone the second 2 weeks. All right. And this is the uterus. This is that fertilized egg. All right. So we're going to go through a menstrual cycle. All right. So last month you didn't get pregnant. So that tissue from last month went away. That's why you have your menstrual cycle. All right. So during that time, both of these hormones are low. Now, what did I say? Estrogen causes growth, and it's dominant the first 2 weeks, right? So now here comes estrogen regrowing the tissue. All right. So you want it to grow. Now, how does that happen? Well, you have this little follicle in your ovary that tries to develop into an egg that ovulates, that comes out waiting for sperm to fertilize it. All right. Now, after this egg comes out, and only after that egg comes out, only after ovulation, do you make this thing called a corpus luteum. All right. So that's the remnant from where this egg came out. The corpus luteum makes progesterone. Progesterone slows down the growth. Okay, see, the growth slowed down, and it developed that tissue waiting to see if you're going to get pregnant. If you don't get pregnant, the corpus luteum fades away, and the tissue fades away. You have another menstrual cycle. All right, here is the key. This step right here is very delicate and sensitive. In order for you to ovulate, everything has to be just right. You can't be under too much stress. You can't have too much fat tissue. It's very delicate. Things in the environment can affect it. So that's why, that's infertility, is most of the time it's anovulation. You're not ovulating. And if you don't ovulate, you don't make this thing called a corpus luteum. And so you don't make progesterone. Or if this egg has somehow been damaged just due to age, because you don't make new eggs. The eggs you have at 40 you had them all your life, and they can get damaged by radiation. They can get damaged by toxins that you've taken in. So as you get older, ovulation becomes more irregular because these eggs or these follicles are trying their best to ovulate, but sometimes they don't. So now you have a lot of estrogen being made and maybe not enough progesterone. Now, progesterone also acts like an anti-anxiety and an anti-depression type hormone. So in the second half of your cycle, if this curve is blunted, you're going to have anxiety and depression. You're going to have bloating. You're going to have weight gain because estrogen also stimulates fat production and progesterone helps you to burn fat for energy. So that's why I measure this balance right here. This is what is important. And if you can understand this, you'll be able to discern a lot of information. And you'll understand that estrogen is not your problem. Estrogen is not the problem because you can make estrogen if you don't ovulate. And that's what PCOS is. When you have a lot of these, because what happens is your body will make a lot of these follicles just hoping one will ovulate. And if it doesn't, what you have is you have a lot of cysts making a lot of estrogen. So that's why they call it polycystic. And what you have is that you're not making progesterone. All right. And then what happens is your body tries to maintain some type of balance. So you begin making testosterone to counteract the estrogen. So that's why in PCOS, you can get hair under your chin, you can get thinning hair, you get start to gain weight because you have all this estrogen, and then you have testosterone trying to balance it out because you don't have progesterone. The treatment for PCOS is to restore your progesterone. That is the key. All right. So, Rebel, I'm trying my best to simplify this as much as possible, but women need to understand their menstrual cycle. So tell me where I'm not clear or where anybody has any questions. I'm trying to show you that everybody's heard of estrogen. And estrogen is the easiest thing for you to get. You make estrogen here. They give estrogen to cows, so it's in the meat. There's estrogen in your water. There's pesticides that act like estrogen. So to think that deficiency in estrogen is the problem in women is totally backwards. All right. So Rebel, have I explained that enough, or do I need to go further?
No, I believe that we are all sitting here with our pencil and paper, taking notes, learning, and remembering things that, we should have been taught a long time ago. But yes, you are perfectly clear.
Because you do this every month and you need to know what's happening with you. And don't listen to a doctor or anything, because I'm going to tell you, I did not really understand this, and I did a 4-year residency. What I learned was if there's any problem here, give you birth control pills. That's what I learned. Now, I know I may have passed a test on this, okay, but I never really put it into practice. I just gave women birth control pills, and that's what they get. Nobody sits down and explains this to you. They just write a prescription for birth control pills. And then in 3 months, when you say that it's making me gain weight and all this stuff, then they change you to another birth control pill. Is that true or not, Rebel?
I have never taken those because, I'm sorry, they put me on them once, and I said, something's not right with this. Something just don't set right with me, because it says birth control. Yeah. That means she just wanted to stop. I'm like, well, and at the time they tried to put me on it, it's like, I'm not sexually active, so I don't need those things.
Yeah. And that's what I'm saying. It's a contraceptive. It's not made to balance hormones. So I want to get to this because I know we're getting close to the break, and I want to go to some other issues that's popular thinking. So this is a quote, and I used to say this is what I live by, is this quote right here that's from Spiroff. It says the ultimate biologic response. So that's what everybody wants. We want the ultimate, we want our biology to work as good as possible. And the ultimate biological response reflects the balance of actions of the different hormones with their respective receptors. All right. So I'm going to work backwards. So you don't have receptors for what's in birth control pills. Okay. You have something called progestins that aren't really progesterone. So those are chemicals that you really don't have receptors for. And in order for it to be a drug, it has to be something that's not found in nature. So any drug you take, your body does not have receptors for it. So I need to use the hormones that you have receptors for. And those are the bioidentical hormones that your ovary made. So when I'm giving you a hormone, I'm giving you a hormone that you have receptors for. But then I want to balance it. And the only way you can balance something is to measure it. And I just showed you a slide that said serum measurements don't have any clinically useful information. So I can't balance anything in the blood. So I have to figure out another way to balance it. All right. And that is in the saliva gland. And I'll try and get to that. So in order for you to have the ultimate biological response, we have to give you hormones that you have receptors for, which are bioidentical, estradiol and progesterone, just like I showed you in your menstrual cycle. I'm giving you those exact hormones, but I have to balance them. And you balance them by looking at saliva, because serum is not going to do it accurately for you. All right. So, and some people say, okay, well, I measured in the urine. Let me tell you what the problem with this and that. Biologic and metabolic effect is determined by the cell's ability to receive and retain the hormone. For estradiol to have an effect, it must be grasped by the receptor within the cell. So I know that may be, so this is what I want you to see. Estradiol may produce its effect several times before it is metabolized. So in urine, you're looking at estrogen metabolites, but it could still be in the cell and it could be acting like estrogen, and you don't see it in the metabolites because it's in the cell. It's not being metabolized by the liver. So if you look at urine metabolites, you're not really seeing that the hormone is being retained and it's having its effect several times before it's metabolized. So there's some people who like to look at urine metabolites. They can be useful because you want to see how your body is dealing with the estrogen, but they don't really give you information so you can give a person the ultimate biological response, because that's what we're looking for. So we got 3 minutes and I'm going to try and explain this to you. So this is why I look at saliva, because this is the blood, okay? And because these hormones are fat soluble, they're really carried around in these little things called sex hormone binding globulin. And I call it a FedEx truck. So the FedEx truck is traveling through the highway system here, which is your blood, and it releases hormones into the fat tissue that surrounds the cell, or we call it the extracellular space. All right. So all of this hormone is here that you don't see in the blood. Okay. All right. So now this hormone that's here, it has to go into the cell, and that's where it will do what it's supposed to do, either have growth or development. All right. So if you're looking at the blood, you don't see this hormone here. And this is what is affecting the cell. All right. So what do? Well, this right here is the fat tissue around the saliva gland. All right. And this is one of the places where the FedEx trucks delivers hormones. So if I know what the normal range of hormone is in the saliva gland, and I see that that's in balance, then I can assume that the hormone is in balance in other places. So that is why I use salivary testing, because it shows me the hormone that is available for the cell to use, not just what's floating around in the blood. And only 1 to 2% is actually in the tissue. The rest of it is in the blood being bound, and it is not available for the tissue. So just think, if the blood, so let's say 99% of it is supposed to be in the blood and 1% is here. So let's say 2% is here, 2% of estrogen. So now your estrogen has doubled, that is affecting the tissue, but I barely see it in the blood. Okay. and then it can be retained there for days or weeks or whatever. So whatever got delivered on Tuesday and it's not in the blood, it could still be here Thursday, Friday, Saturday, or Sunday, because it can be retained outside of the blood. All right. So it's time to go to break. So am I making myself clear? Because the next thing I'm going to do is talk about the fallacy of testosterone. So, so can you understand the menstrual cycle and why the blood doesn't tell you anything? And you, in order to balance hormones, you have to look where the hormones are and balance them there, and not balance them on the FedEx truck. So that's the takeaways before we go to break. So let's come back and I'll review this, and then I want to go and I want to tell you about the other fallacy is all of these women taking testosterone. So let's go to break.
We are going to a quick break, so stay with us as we explore the ageless blueprint right here on W4HC Radio and Talk4 TV. An ancient secret with a modern twist for better health and vitality. Dr. Taylor will be right back. Taking care of your health shouldn't mean taking a handful of pills every day. At Taylor MD Formulations, they create doctor-developed supplements that combine the best natural ingredients so you get the results you need with fewer pills. Taylor MD Formulations is backed by science, designed for real life with real results. Less pills, better health, doctor approved. Shop now at TaylorMDFormulations.com and discover smarter supplements for smarter health. That's TaylorMDFormulations.com. We are back for more of Ageless Blueprint. Once again, let's join Dr. Taylor for more insights and research on the ancient secret to better health and a better life in modern times. Here's your host, Dr. Eldred Taylor.
All right, we are back. So, Rebel, tell me, am I making myself clear? So here are the takeaways. Estrogen causes growth. Progesterone slows down growth and stimulates normal development. Growth without proper development can lead to problems. The worst problem is leading to cancer, because uncontrolled, undifferentiated growth is the definition of cancer. All right. So that's the worst case scenario. But also, growth without development can cause irregular bleeding, heavy bleeding, iron deficiency anemia, fibroids, endometriosis, PMS, PCOS. So almost every problem that a woman has is due to an imbalance of estrogen and progesterone. I can almost say that as a blanket statement. It's always an imbalance. And I'll tell you, I do salivary testing in my office, and if I find these symptoms, I can't remember when a test came back normal when I thought that there was a hormone imbalance. That's how prevalent this is. All right. So anything I need to clarify, Rebel, in your mind?
I wish they would teach these things in school, like prior to a girl getting her period, because why, you didn't know these things.
I know.
This is nuts. So here, how do you get rid of it if, like, all of these things that happen, how do you get rid of these growths that, these things that can grow? What happens? How do you balance this out? How do you fix this?
Well, it's by giving progesterone. You can give progesterone orally. You can give progesterone as a cream. You can give it as a cream. You can give it as pellets. It's all about balancing estrogen and progesterone. And then it's cortisol. I told you we wrote 2 books, Are Your Hormones Making You Sick? And The Stress Connection. If you understand those 2, you will be well on your way to good health. Okay. And you have to eliminate stress, or you have to manage stress. You have to measure it and calm down that nervous system, that fight or flight. And then you have to balance hormones. And so the best thing to do is to balance them before you get any of these growths, especially cancer and fibroids and all that. But you're right. a lot of that you're exposed to early on in life before you even know anything about this. And that's why you can see 20-year-olds with fibroids. Okay. And some of it's not because of them taking estrogen or whatever. I tell you, it's in the food, it's in the meat that we eat, it's in the air that we breathe, it's in the pesticides that they're spraying on these crops that we're eating. That's why you want to eat organic. So it's almost hard to avoid estrogen, but everybody thinks that they're low in estrogen, which makes no sense. And part of that is because they're measuring it in the blood and it's not telling you anything. And so you make decisions based on bad information. So I want to share my screen because I want to talk about testosterone, because that's another popular thing, is that women need testosterone. And that is just simply not true. Okay. So if I can go to share my screen, let me go to that real quick. Okay. So this is what I want to share. All right. So testosterone in the menopausal transition. All right. Understanding how testosterone production changes during menopause is crucial for women's health. While estrogen levels drop dramatically from the ovary, and I'm going to talk about that. The ovary, it drops from the ovary, but it doesn't necessarily drop totally. Testosterone follows a different pattern that may surprise you. All right. So here's the number one thing, that testing testosterone in women is almost always inaccurate. Okay. Measuring testosterone levels in women is significantly more complex and often unreliable due to several inherent limitations in current testing methodologies. And I went on deep research in ChatGTP to prove this point. Okay. So if you want the references, I can send it to you. These assays are optimized for men. Okay. Men have much higher testosterone levels, and it's much more important in men than it is women. There's cross reactivity. These immunoassays have to be very specific for testosterone in women because it's always so low. It's a very low level of precision, because testosterone levels in women are supposed to be low, and they're so low that these tests that are optimized for men won't show it. So it's always going to look like women need testosterone if you're looking at it in the blood. You have to have very specialized methods. And even if you look at free testosterone, it's not telling you what's available for the tissue, like I showed you with the saliva gland thing. So clinical signs are paramount. So due to testing limits, clinical signs and symptoms are more reliable indicators of testosterone status than isolated blood test results. So in Spearoff, it says a woman can be hirsute, and hirsute means that they can have a beard and testosterone. And you look at their serum measurements, and it's still low. So if you're looking at that, it's going to look like every woman needs testosterone, but it's not. It's due to bad testing. All right. So the sources of testosterone in women. Now, the ovaries make about 25%. The adrenal glands, which are these glands that are right on top of your kidneys that make cortisol and testosterone and androstenedione, they make a lot of the hormones. And peripheral tissues, 50% from hormone conversion in tissues throughout the body. So you can make testosterone in multiple ways, and the ovaries are not a big source. And here's the deal. There is not a sharp drop of testosterone in menopause. There is no dramatic fall at menopause like there is with estrogen. Cross-sectional studies show little to no change in testosterone during the menopause transition. Now, again, the drop in estrogen comes from the ovary, but your fat tissue still makes estrogen. I'm going to try and get to that slide before we finish. This gradual pattern contrasts sharply with the steep decline in estrogen made by the ovary that defines menopause. And ovarian activity continues after menopause, even after your period stops. The ovary continues producing testosterone. You have elevated pituitary, LH, and FSH actually stimulate these cells to produce androgens, which is testosterone, despite low estrogen levels coming from the ovary. The adrenal glands, which are the primary source of testosterone in women, they're not affected by menopause. Okay, this doesn't have anything to do with your reproductive cycle. So adrenal glands continue producing DHEA and other testosterone precursors at the same rate during menopause. Testosterone sources decline gradually with age, not because of menopause specifically. All these postmenopausal women are told they need testosterone for energy. So now, if you have surgical menopause, you will have a drop in testosterone. All right. The difference is dramatic. Surgical removal of ovaries causes a significant testosterone drop, but you're not going to see it in the blood. While natural menopause may even see slight increases after 70. So your testosterone can go up even during menopause. The sex hormone. So remember those FedEx trucks? This is the FedEx truck. So after menopause, sex hormone binding globule levels decrease. This protein normally binds testosterone, also estrogen, making it inactive. If you lower the number of FedEx trucks, you get more free testosterone. So sex hormone binding globulin goes down with menopause. So now you have more free estrogen, even though it doesn't come from the ovary, and you have more free testosterone. So here's testosterone levels. So as you age, okay, if you have natural menopause, testosterone starts to go up as you age. That's why you see these women who are postmenopausal grow a mustache and lose their hair. It's because of testosterone. It's going up, all right, because it's trying to take the place of the progesterone that you lost because you don't ovulate anymore. So we all see these older women, they have real thin hair, just like my hair is thinning, okay? And they grow a mustache, they have chin hair, they have all of this stuff. It's not due to a lack of testosterone. Their testosterone is going up. That's why I say you have to look at the clinical picture and not at the blood test. So for natural menopause, testosterone deficiency symptoms may not be directly related to menopause itself, but rather to normal aging. Women with surgical menopause is a problem. So each woman's hormone profile is unique and requires personalized evaluation rather than assumption based on menopausal status alone. So we all see these older women, their hair falls out, they have these bald spots, they have too much testosterone. And if you give them more estrogen without progesterone, they're going to make more testosterone. Sometimes I get upset. So estrogen production after menopause, they kept saying that, hey, estrogen plummets at menopause. That's not all the way true. While ovarian estrogen production sharply declines after menopause, the body maintains a vital secondary source, the conversion of androgens to estrogens. So androgens are things like androstenedione and testosterone. You can convert testosterone into estrogen in your peripheral tissues, in your fat tissue primarily. This process, known as aromatization, is crucial for postmenopausal health. So I always say that God made it where women could remain being women even after menopause, even after they stop being reproductive. Women still want to be women, so they are naturally have more fat tissue because fat tissue can convert testosterone and other androstenedione things coming from the adrenal gland, and they can convert it into estrogen. So not only can they do it in their adipose or in their fat tissue, their muscles can make local estrogen. Their bone can make estrogen. Their brain can make estrogen, influencing cognitive function, mood, and neuroprotection. But this estrogen has to be balanced by progesterone during menopause because you don't have a backup system for progesterone. You have a backup system for estrogen. Your adrenal glands can make testosterone. Your ovary can still make testosterone, but you have no other source for progesterone. So that's why 80 to 90% of my patients are just on progesterone. So now I don't have to worry about stimulating cancer. I don't have to worry about stimulating fat growth. I don't have to worry about any of the, are you starting to bleed again? I don't have to worry about any of that because I am only trying to replace the one thing that definitely goes away at menopause. When you stop ovulating, you stop making that corpus luteum. And that corpus luteum is what makes progesterone. And 100% of women will stop ovulating at menopause. So that means 100% of women are going to stop making significant amount of progesterone without a backup system. All right. So I hope I've gotten that message out. So I'm gonna stop sharing my screen here and go back to here. So everybody sees me now. We can just go to me. So we got what, like 4 minutes left. Do we have any questions? Because if you have a question, I want it answered. Again, this is what I want to teach in my office visit, but a lot of times I don't have the time, and that's why I see patients coming back all confused and discombobulated, like, oh, I heard this and this person on Instagram said that, and when you are confused, it paralyzes you, so you don't do anything. That's what my patient did. She was confused, so she stopped everything. So I don't want you to be confused. I want you to be 100% sure about what I am telling you. Okay. And I can back it up. I showed you everything I'm showing you is I got it straight out of the textbook. And that's why I say learning is remembering. I don't want to hear about an expert new opinion. And that's what is going on. Oh, this expert said this. I don't want to hear about an expert. I want to know the basic physiology. I don't call myself an expert. I'm a communicator of the truth. That's what I consider myself. And I try to break it down so that any person can understand it. And if I haven't done that, I'll try again next time. But that is my goal in life, is to get this message across. I told somebody, hey, I'm getting older. I don't know how much longer I can do this. I hope it's another 20 or 30 years. But I fought this battle 20 years ago. I went around speaking all over the country and writing books and all this. And now I realize there's a whole new group of people going into perimenopause and menopause. There's a whole new group of doctors that are not understanding menopause. So I have to do it all over again. And so that's what I'm doing. So, all right, Rebel. All right, can you get pregnant after menopause? Now, that is a miracle, because the definition of menopause means that you have no more eggs. You're not ovulating anymore. And if you don't have an egg, you're not going to be able to get pregnant. So that is something that that's the way God made it. Now, could there be a miracle? There's always miracles. But based on physiology, no. Can you start bleeding after menopause? Yes, you can start bleeding after menopause. And if you're not on hormones, that is not a good sign. So anytime you have postmenopausal bleeding, the number one thing you have to rule out is uterine cancer. And you have to do a biopsy to make sure there's no cancer there. And if there's no cancer, then I can guarantee you have a progesterone deficiency problem. That's why you're bleeding. That you are getting exposed to too much estrogen. It's causing that uterine tissue to grow, and you don't have enough progesterone to slow down that growth. Does everyone need hormone replacement? Well, this is what I'll tell you. 75% of the world doesn't go through any of this stuff, okay? Because they live in a less industrialized area. They probably grow their food in their backyard or in their field, so they're not getting exposed to pesticides. They have a low stress life usually. And so most people don't do that. But in industrialized nations like the US, that we're exposed to all of these chemicals, we are under stress all the time, then I won't say 100% of women need it, but the natural flow of physiology as you get older, then it's going to set it up for that to become imbalanced. So I never say that 100% of people need anything. But if you have any of those symptoms, it's more than likely you have a progesterone deficiency problem. What effects does male testosterone cream have on women? It's going to cause you to lose hair where you want it and to gain hair where you don't want it. And I will tell you that you are getting testosterone and it's saying it's for energy, but your real problem is cortisol. And maybe my next podcast or look on YouTube, And I can talk about cortisol and how low cortisol equals low energy. It's not about testosterone and energy. I don't care how popular that thinking is. It is not based in science. Testosterone is a male hormone. You would never get a man to take estrogen saying that it's good for them. But you have women taking testosterone, and doctors telling them that that's what they need. That's not true. All right. So what can we do about cortisol? Okay. Hey, remind me, Rebel, I'll talk about cortisol next time.
Sounds like a plan.
All right. Goodbye, everybody. I hope you took your notes.
Thanks for joining Dr. Taylor today. If you missed any part of this show, just check out the podcast wherever you listen to podcasts. Ageless Blueprint is every Wednesday at 9 a.m. Eastern Time on W4HC Radio at W4HC.com. Together, we discovered ancient secrets to better health through science and spirituality made for modern times. Until then, feel free to check out agelessblueprintpodcast.com and TaylorMDFormulations.com for more information.